In this video, we'll cover Orbit's imaging, including relevant CPT codes, common radiographic views, and a sample radiology report to guide your documentation and coding decisions. When coding for radiologic examination of the orbits, consider the following CPT codes. 70030 Radiologic examination of the eye for detection of a foreign body. This is used when a foreign object is suspected and a basic X-ray is needed to locate it. 70190 Radiologic examination of the optic foramina. This involves imaging the bony openings at the back of the orbit and is typically used to evaluate trauma or suspected masses. 70200 Radiologic examination of the orbits, complete, minimum of 4 views. This is a more comprehensive study that includes at least 4 distinct views of the orbital structures and is the most commonly used code for orbital trauma evaluations. Each of these codes must match both the clinical documentation and the number and type of views captured in the imaging study. Let's go over the standard views used for orbital imaging. Orbit's PA axial view, Orbit's PA axial view orbital method, Orbit's lateral view, Orbit's modified waters, Orbit's parieto-orbital oblique view, Rees method, orbital margin PA oblique view. Let's look at a sample radiology report corresponding to CPT code 70200, which requires a minimum of 4 views. Order exam Orbit's 4 views. Views taken lateral, water, oblique, and Caldwell. History, left orbital pain. Comparison, none available. Findings, no definite fracture is seen. Paranasal sinuses appear aerated. Dental restorations are noted. No foreign body is visualized. Impression, no definite fracture. If clinical concern persists, recommend CT of the maxillofacial bones for further evaluation. This report supports 70200 due to the comprehensive set of documented views and clearly indicates the clinical rationale for further imaging if necessary. When reviewing radiology orders or reports, you will see vague history like other or L-orbit other. This lack of specificity presents a challenge. If there's no clear documentation of why the patient is being imaged, here's what you should do. Check the medical chart if available. Look for ED notes, triage summaries, or injury descriptions. If trauma or specific symptoms are found, you may be able to code for a symptom like pain or swelling or a specific injury instead. Without clarification, Z043 is the default for this situation. 70030 Radiologic exam of eye for foreign body was traditionally used for basic X-rays of the eye to detect metallic or radiopaque foreign bodies after minor trauma or industrial accidents. Plain X-ray is now considered clinically limited for eye trauma. It can't reliably detect small or non-metallic foreign bodies. Since this code lacks sufficient diagnostic value in modern practice, this code may not meet medical necessity guidelines and is often denied. CT imaging of the orbits without contrast is now the gold standard for evaluating possible intraocular or intraorbital foreign objects. It offers much better sensitivity and 3D detail. Next, let's look at 70190, Radiologic examination of the optic foramina. This code refers to imaging the openings at the back of the eye sockets, where the optic nerves exit the skull. In nearly all current cases, the optic foramen is included as part of a complete orbital study, coded as 70200 or evaluated through head and facial CT scans. It's highly uncommon for providers to order an isolated X-ray of just the optic canals in modern radiology practice. Just like 70030, this exam doesn't provide the level of detail clinicians now expect for evaluating trauma, tumors, or optic nerve compression. Thanks for watching. If you found this video helpful, be sure to download the complete radiology coding PDF that includes CPT codes, imaging view summaries, and reports, all in one easy reference. Don't forget to like, subscribe, and for more medical coding tutorials. Until next time, code with confidence.